will be muted. The audio will be streamed through the computer, so please make sure your computer speakers are turned on and up to hear today's presentation. Now I'm going to review a few housekeeping items for everyone. If you notice that your viewer does not fit your screen, you can expand it by clicking the expand button located in the top right corner indicated by the red arrow. Now you will see that your viewer is expanded to fit the entire screen. Also, you can collapse the GoToWebinar toolbar on the right of your screen by clicking on the small red arrow on the left of the toolbar. There you go. And then click the arrow again to expand the toolbar and it will expand. For today's webinar, as I said, all participants will be muted. As we move through the presentation, if you have a question for a presenter, we ask that you use the chat box on the toolbar. Simply type your question and hit send. We can pause for a presenter to address questions at an appropriate time during today's presentation, and we will do that again at the conclusion. Also, a recording of today's webinar along with the PowerPoint slides will be available at our website at www.attcnetwork.org/Hispanic Latino approximately 1 week from today. You can also find recordings and PowerPoint slides from our previous webinars. One NADAC, NBCC, and ICRC CEU is available for those attending the entire webinar today. If you're interested in obtaining CEUs from these organizations, you may email us at hispaniclatino@uccaribe.edu. Today's webinar is sponsored by the National Hispanic and Latino ATTC. As of October 1st of 2012, the network has been restructured and now consists of 10 regional ATTCs, 4 national focus areas ATTC, along with the network coordinating office. As you can see by this map, the ATTC network regions were realigned to better fit the current regions of the HHS. And the 4 national focus area ATTCs are listed on the left. Today's webinar is the 4th in a series that the National Hispanic and Latino is offering. The ATTC network is funded by SAMHSA and serves a critical role in improving the health of our nation. The network achieves this by translating, disseminating, and promoting the adoption and implementation of evidence-based clinical practices and strives to improve the health and wellness of individuals whose lives have been impacted by the disease of substance use. So you can learn more about the network's products by visiting attcnetwork.org. As I mentioned, the ATTC network is funded by SAMHSA, and SAMHSA strives to reduce the impact of substance abuse and mental illness on America's communities through its programs and services, and demonstrates that behavioral health is essential to health, prevention works, treatment is effective, and people recover from mental and substance use disorders. You can learn more about SAMHSA by visiting www.samhsa.gov. So now, I'm going to introduce our presenter. Mr. Victor Flores is originally from Nogales, Sonora, Mexico. He possesses a master's degree in counseling with an undergraduate degree in sociology. His experience has allowed him to be in various positions within a multiplicity of systems, including course, behavioral health, and other nonprofit organizations. Currently, he provides assessment, screening, and ongoing treatment to specialized populations. He possesses a license from the Arizona Board of Behavioral Health Examiners in order to deliver services in Arizona. The services are responsive to the culture and to the linguistic needs of those he serves.
He has offices in Phoenix and Tucson. He is the TA and Training Development Consultant for the National Hispanic and Latino ATTC. Now we're going to turn over to Mr. Victor Flores to continue the presentation. But before we do that, we would like to do some poll questions, and all attendees will be able to answer these questions. The first question, so that we can know our audience here today, is: do you currently serve Hispanic and Latino populations? I'm going to give a few seconds for people to respond. All right, we got a couple more seconds. Okay. Thank you, everyone. Now, the second poll question is: are you planning to serve Hispanic and Latino populations with substance use disorders in the next 6 months? I'm going to launch that poll question right now. I'm going to give you a couple seconds so you can answer. All right, it seems like most people said yes. Thank you very much. I'm going to close the poll question now. The third question here is: which field of work do you represent? I'm going to launch the question right now. I'm going to give you a couple seconds so you can answer. All right, it seems like most people work within the substance abuse field and mental health field. That is great. I'm going to close the poll question now. What is your current professional role? All right, it seems like most people exercise the role of counselors, therapists, and social workers. That's good. I'm going to close the poll right now. And the last question: what type of setting do you currently work in? All right, it seems like for the most part of the attendees work within the substance abuse treatment outpatient and inpatient facilities. All right, I'm going to close the poll right now. Thank you, everyone, for responding to these poll questions. Now I'm going to turn it over to Mr. Victor Flores so he can continue with this presentation and the webinar.
Thank you, Jesus. How do I sound, Jesus?
All right. Now, Victor
Okay,
is going to be the presenter right now, and he's going to show his PowerPoint presentation to us. You might want to click on the right there. Yes? There you go.
How do I sound, Jesus?
Good.
You're good to go, Victor.
Oh, okay, good. Then I'll go ahead and get started. Jesus and Daddies, thank you very much. What I'll go ahead and start with is just one of the pieces that's important is, as we go, either be jotting down questions or sending in questions, because what I asked Daris and Jesus to do for me is to go ahead and get those questions, and they'll be stopping me about halfway into the presentation. So that way I'll get to talk about some of the things, and then before we forget anything, we can just continue. So anyways, I'll start with that. And as was said before, you know, one of the things that I really like to do is teach and also train. So this is how I got here. So I'm really glad we get to talk about this really important issue. You know, last month the National Hispanic and Latino ATTC, we were in Charlotte, North Carolina, and we got to do a training on training of trainers in Charlotte with the cultural elements. And one of the things that was really a good piece of it was the acculturation piece. And we oftentimes talk about acculturation as part of a bigger presentation, but I'm glad we get to give it some attention today. So having said that, you know, some of the things with reference to acculturation, some of the things that come to mind are the amounts of persons we're talking about. When we talk about Hispanics and Latinos, we're talking about a population that's very significant in terms of numbers. And another thing that we start talking about are the issues that come about as a result of us as professionals working in the field of behavioral health, substance abuse, etc. And then we talk about language. Language is such an important piece of everything we're talking about. And then immigration, assimilation, and as I mentioned, cultural competence is sometimes what we talk about, and acculturation is a piece of that. And why is this so important? Well, there's different trends that are important in that, you know, such as, you know, just to mention some, Latino adolescents, they engage in high levels of risky psychosocial behaviors that are related to negative long-term consequences for health and well-being. And according to places like the Center for Disease Control, the Youth Risk Behavior Surveillance System, Latino adolescents report high levels of internalizing mental health systems, high percentages of Latinas considered suicide, some attempted suicide. So these rates we're talking about are usually higher than actually they're higher than other racial and ethnic groups, and that's why this is significant. It's not because we're saying, okay, let's just focus here. There's actually some data that reveals that this is such a pertinent issue. And acculturation, again, is about it's about getting that information. So as I mentioned, in terms of demographics, we're talking about Latinos now comprise the largest minority group in the United States. Why is this significant? Well, we're seeing that we're able to deliver, or sometimes in some cases not meet the needs that are before us. So that's why this becomes such a hot button issue, such a important and crucial issue. 16.7 of the total U.S. population, and again, please remember that when we talk about how folks are counted, we oftentimes have those folks that are not counted. You know, I'm in Arizona, and I know for a fact that there's a portion of people that are not accounted for within this group because it's difficult to report. Some people that don't report, if that makes sense. So, but I'll cover a little bit about that in the immigration piece. You know, when we start looking at the numbers per se, we start looking at how those have changed over time. And if you look at this chart here, the population grew by 43% from 35.3 million, and that's really a growth rate of 37.3%, almost 3 times the rate, which is 14% of the total U.S. population, accounted to half of the 51.4% of the nation's population growth over the same period. That's pretty significant. And although these numbers, you can see them, and they're ranked in order according to the amount of persons per group. One of the fastest, if not the fastest growing rate, is the Central American group, which is, if you look on that list, the 5th one down. So again, this is significant because we're seeing people immigrating to the U.S. from different areas, not just one, but from different areas, and the growth rate is astronomical. When we look at some of these trends, we see that this is important because we feel it in everyday terms. I mean, different things such as where it's felt is in politics. I know that's one of the things that we often talk about as far as where there's a presence of each group. And in this group, you see it in politics, education, business, social service, and for us, behavioral health. And that's such an important thing, because if you can see the numbers, that's a steady increase that is going to be, how do we mobilize to meet the needs of this ever-increasing group? How do we mobilize to increase the needs, to improve the outcomes on this group that's so diverse? So it's, again, it's a growing group, but it's there's so many differences even within the structure of the group. As I mentioned earlier, cultural competence is a cornerstone of everything we're talking about. It's how to be able to really meet somebody where they're at, and in this case, recognize and respond to health-related beliefs and cultural values, etc. Some examples of culturally competent care include such things as striving to overcome cultural, language, and communication barriers, providing an environment in which patients or consumers from diverse cultural backgrounds feel comfortable discussing their cultural health beliefs and practices in the context of negotiating treatment options, using community workers as a check on the effectiveness of communication and care, encouraging patients, consumers to express their spiritual beliefs and cultural practices, and being familiar with and respectful of various traditional healing systems and beliefs, and where appropriate, integrating these approaches into treatment plans. That's a mouthful, and that's a lot of information, but to be really culturally responsive really means that we start getting in a place where we're recognizing and we're doing what we aim to do. None of us actually came into this field because other than wanting to help, at least most of us, because I heard that most of us fall into social worker, counselor, therapist. I'm a practitioner. Aside from this, I'm a practitioner. I do screening, assessment, and ongoing treatment of with adults, and that's what keeps me, adult sex offenders, and that's what keeps me clinically crisp, clinically sound. So I do that, and some of them are in multi-system. Some of them, or actually all of them, are involved with the courts, and more than half of them are involved in our behavioral health system. So there's a lot of cross-system interface, but more than anything, we're talking about different people that are from different cultural backgrounds that are being served. So we become navigators, and I don't want to say experts, but we become very knowledgeable of different pieces of the system and how to serve people in appropriate ways. Again, in terms of culturally competent treatment services, culture plays a key role. There's no doubt about it, and we can influence patients in certain ways, or we can be influenced. However, we can't afford to let cultural barriers limit our ability, and that's one of the things that we start talking about when we start talking about disparities. Cultural differences are more sharply drawn in our approaches and definitions of health and healthy living. By deepening our understanding of culture, we can strengthen the promise of high-quality treatment that is accessible, effective, and cost-efficient for all patients. And one of the things, again, rather than sit here and say this is what we need to do, I think one of the things that is more what we're talking about is an awareness of systems, an awareness of ourselves, an awareness of those we serve, and even an awareness of the expectation of us. I think that's very important. So then we start talking about such words and such ideals, and as assimilation. Oftentimes we start talking as assimilation as interchangeably with acculturation. Let me see if I can capture the difference between the two. In this slide, you'll see that it's the way it's mentioned is changes in language preference, adoption of common attitudes and values, membership in common social groups and institutions, and loss of separate political or ethnic identification of one group as they come in contact with their host society. And that is, again, the focus is on the group rather than on the individual, and how minority or immigrant groups relate to the dominant or host society. That's essentially what it is. And again, we often utilize assimilation and acculturation interchangeably, but there are some pretty significant differences, and I oftentimes with my colleagues and in general in trainings, we talk about assimilation as a blending. And when we talk about blending, we talk about blending into the the larger group or the whole society. And sometimes for some of us that have lived that, we find, whether it's personally or looking from the outside in, we find that some of our traditions, norms, language are sometimes lost and assimilated into the larger group, whereas acculturation is a little different than that. In looking for acculturation, there are a ton of definitions, and those that work in the field are very cognizant to give these comprehensive, very all-capturing definitions that are very good. They capture every element. But instead, I opted to kind of look at a definition just from mainstream. So I chose a dictionary, and not because of any other particular reason, but just to see how it was mentioned there. And one of the things, as far as that I like looking at, was the definition from the Merriam-Webster dictionary from online. So it was pretty simple to do. And if you look at this, cultural modification of an individual, group, or people by adapting to or borrowing traits from another culture. Also, emerging of cultures as a result of prolonged contact. And that almost sounds like assimilation. And then the second there is the process by which a human being acquires the culture of a particular society from infancy. And those, again, they sound, in Spanish we say acculturation is the cousin of assimilation. In the way I was just discussing this with one of my colleagues this morning was assimilation is how you blend into the larger group, whereas acculturation is what you retain from yours. Even though there's a blending mix in process, it's really what you retain. In one of the things I oftentimes look at, maybe a 4th, 5th, 6th generation family that's been here, and they still have different things going on, like piñatas, and they still have some words and language that they still utilize. In my case, Spanish. So unlike my children are first generation, I can see some of this going on. They're retaining their language, but at the same time, they're speaking a lot more English than I did when I came to this country, which was 0. So that definition is captivating, but more than anything, it's important to understand that there is a bit of a difference between acculturation and assimilation. Again, acculturation is did I jump ahead of myself? Okay, here we go. Is so important to look at in terms of the process in which members of one cultural group adopt the beliefs and behaviors of another group. Again, this is what we've been talking about in terms of the pieces that are so important. And what do we retain? What do we lose? And again, reciprocal. I just gave an example of a piñata, and that's just such a prime example of how we retain some of those customs, traditions, and beliefs. So why acculturation? Why acculturation? Well, acculturation, we start talking about such things as the need. Acculturation has to do with the fluency in language and ability to function in formal and informal social settings and institutions. Acculturation has been shown to have a direct relationship with levels of alcohol and drug use. In another example, Mexican American males exhibit high rates of consumption and public drinking. And we can see, oh, okay, so based on this visible styles that we see, some people sometimes adhere to what we call our stereotypes, where they believe this is what we're seeing, this is the way it is with that group. But actually, research has shown that drinking rates of Mexican Americans in the United States are much higher than drinking rates of Mexicans in Mexico. So this is pretty significant. It's important to know these nuances and regionalisms. So those kinds of things are why acculturation is so significant and so important to us. So that's how it relates to why acculturation within behavioral health, within substance abuse, within addictions. And then we started hearing to what we oftentimes refer to as the family. And again, I put something on parenting here as an example, if you will. And some suggest erosion of protective factors of the culture of origin accounts for increased risk factors across generations. And for example, parenting practices and relationships among Latino families are organized by values highlighting the centrality of family integrity. Familismo is a dynamic construct often defined as a normative set of values endorsed by Latinos. But what we've seen is that over time, familismo, or the orientation towards family, it kind of erodes, it changes. And I can see it even within the structure of my own world. And having come here and being so, I guess, interdependent and also so reliant within the whole family structure. And as we come more, if you will, using the word Americanized, within my own family structure, I see that a lot of that familismo and focus on the family, it starts doing things that are not necessarily bad, but they're different. And that happens within the dynamic of those we serve as well. And when I say it becomes different, I see families of even my own relatives that move to other states, and that was unheard of when we came to this country. It was we all were all together. So those kinds of things are just so important. So when we start talking about parenting and families, we start talking about how important, because as a practitioner, it's not uncommon to have an adult male that comes into treatment, and then all of a sudden their extended family or their a sibling, a mother, a wife, they all want to be included and should be included in the family construct. As a practitioner, the first time I came into treatment, that's the first thing I asked with a 30-some-year-old male. His mother wanted to come in and be part of it, even though he was married, had his own family. I think she still wanted to be part of his family, and that's the first thing I asked. What's your social? What is your support system? And I said, tell me about your family, your wife and kids, and also your parents. And he right away hooked into that, because up to that point, no practitioner had asked about family. And that just seems like common, like anybody would ask that, but for some reason, again, remember, whether you're in a clinical setting, in a court setting, you name it, I think family is a piece that needs to be taken into consideration. Let me ask this of my colleagues right now. How's my time doing? Are we ready for questions yet? Jesus Ordaris? I will take that as we're not ready for questions yet. So I'm going to go ahead and keep on going, because I don't want to run out of time. So as we go, I ask the questions again. Why do we want to know about acculturation? How is it related to those we serve? Because I'm relating it to substance abuse, but in general, I'm relating it to everything we do in what is the social service field. So again, there's some very relevant and crucial reasons as human beings that we want to do these things. Most, if not all of us, came into this field because we're helpers. We're helpers, and as helpers, we want to do certain things. But also, as ongoing learners, we want to, and professionals, we want to improve our skills. We want to increase the way we serve those folks that we came into the field to help. We want to improve outcomes. When it comes to grants, we always talk about outcomes, but when it comes to serving people, improved outcomes means we're meeting their needs. That's in the big picture. That's exactly what we're talking about. So these are the reasons that we take issues such as acculturation into mind. One of the things that's really when I started talking about just acculturation, I started looking at acculturation scales, and way back when, I won't say how long ago, but when I did my master's work, I remember talking about acculturation scales. And one of the things that I looked at, and I'm not here to criticize or anything, but there were some scales out there that were not, let's just say my master's was over 20 years ago. And some of those scales that were out there then, let's just say they've improved quite a bit. And even though the acculturation scales that are now out are a little improved, there's still room for growth. There will always be room for growth, because I'm not sure we can create a tool that's really going to be able to capture those nuances and the human pieces of those we serve. And again, I wanted to make sure that we know that the aim of acculturation scales is to capture the whole acculturation process. And sometimes I don't know how possible that is, but some of these are pretty good. You know, there's different typological and dimensional models. There's such things as unidimensional and bidimensional models. And again, for example, I just mentioned the bidimensional. You know, here's what we're talking about: different dimensions, two different pieces. How a person operates within this group or this dimension, and then this other dimension, and such things as 24 questions about a participant's language preference, customs, and practices. These are the things we extrapolate from this information, and this is a good tool to measure sometimes. And again, there's different models, but when we're talking about measuring more than one dimension, we start talking about being able to see how much more information we can capture to see how much somebody is acculturated or not. And again, how do we determine acculturation? Well, you remember, when we start talking about bicultural, doesn't necessarily mean bilingual and those kinds of things. And again, what we're talking about, the process of moving from one cultural identity to another. And here, when we start talking about one cultural identity, we're talking about ethnic identity, and then when we say to another, mainstream cultural identity. So again, these scales are good, and it's good as a research tool to look at it. But as practitioners, we determine, okay, where is this person? Where do I meet them? How do I know where they're at? And I'm fortunate in that I believe I'm very, I don't know, bicultural. I've a good understanding of this particular group. But when I don't have an understanding, I ask questions. Questions is one of the best, is a tool that one has to move forward and get information on a group that they may not know about. With regard to language, you know, when breaking down language, we make some assumptions sometimes. So Spanish-speaking or highly bilingual clients can be assumed to possess more knowledge about a Hispanic and Latino culture, and this may provide some cultural information. But remember, we're talking about such a diverse group. If somebody speaks Spanish, for example, it's kind of it doesn't make sense to think this is the ambassador from this particular group, because the group is just so highly diverse. Even if you go to one region in one country, it can be different from another region in the same country. So if you get somebody from the coast of, we'll say, Honduras, might be different than it is from the interior. So those kinds of things are just so significant. And to think that, well, okay, you are one that knows all of Argentina, why don't you talk to me about, but it's okay to get information about where that person is from and what their experience is. That makes a lot of sense, rather than think that one person, because they speak Spanish, are the one that knows everything about. You know, we did well, let me say, significant language access and preference is important to Spanish-speaking clients. And again, some agencies have bilingual staff. That's not always possible, and therefore sometimes we utilize interpreters, and in some cases we also need adherence to what we call, and we did a webinar. The National Hispanic and Latino ATTC did a webinar on the class standards, cultural and linguistic appropriate services from the Office of Minority Health. And one of the things when we did that, we know that the 15 standards that are out there are really a good baseline for those of us that are needing structure in terms of being able to provide anything around language access services So linguistic competence is a little different than cultural competence. Just to make sure we know that, because oftentimes most organizations are further down the road than others. Some are further down the road in terms of cultural competence. Some are just getting started in their journey, and oftentimes will mistakenly be inclusive of under cultural competence everything can be included, but it just is so important to be able to distinguish between the different elements of cultural competence. And then that's where we start talking about the different pieces, such as language, such as immigration, such as trauma. So getting back to language, let's keep in mind that sometimes direct translation of some of the things we do in the field oftentimes don't exist. They're not there. So we have to figure out some of these pieces. So matching proficient and fluent Spanish speakers to clients will sometimes help improve access, contact, ongoing care, and outcomes. That helps. But again, if we have an unmet cultural piece where it's more about being able to speak the language and not knowing the culture, that can happen too. So it's important that as we improve our skills, we understand how language plays a role. And again, I will mention one of the most important components of ethnic identity is language. And again, across acculturation instruments, this is one of the things that's a major theme. So given the importance of language, that isn't at all surprising. You know, some of these scales are solely dedicated to linguistic proficiency questions. So how well do you speak English or Chinese? Language is considered one of the most important components of ethnic identity, as mentioned, and it really continues to be. Many of the folks, if you remember the group that is currently referred to by the feds, by the Census Bureau as Hispanic and Latino, again, some of it is based on language speaking, language origin, Spanish. So that's something to just keep in mind. As we're moving forward, I think it's important to talk about immigration. And immigration, as you can see, the numbers here are big numbers. This is a hot button issue. Now more than ever, with amnesty happening and all the migration to different parts of the U.S., we're seeing how this is such a significant issue. You're talking about legal and immigration, and immigration where you're talking about, you know, undocumented kind of things. You know, I'm in Arizona, so this is definitely an issue that comes on any border state a little differently than in others. But nevertheless, it impacts all the states, because one of the things that we oftentimes talk about when we talk about where the population is settling, there's different places in the country where a lot of the migration patterns are showing that a lot of this population is moving, and sometimes their needs are not being met. And that's because of language issues. That's because of cultural issues. That's because of, in some cases, stereotypes. That's because of different pieces that in some cases make no sense, and in other cases there's just not enough knowledge. So those kinds of things are just so important. And to know that this is something that we're going to be working with. How do we mobilize? How do we move in terms of forward with really serving those that need to be served, that are part of our mix? How do we do that? So some of the immigration issues that really resonate are trust, discrimination, service-seeking behaviors, beliefs around healthcare and addictions. You know, these kinds of things are very real issues. Some systems manage to not, some manage to figure out how to serve according to these issues of immigration. Others have no idea, because this is such an issue that for some states or some systems is new, and they want to know more. Whenever we do our trainings around the nation, this issue always comes up. It always comes up because this is a population that definitely needs services and will be coming into contact at one time or another. So how do we mobilize? So when we start talking about immigration issues, you're talking about in the different places that we've presented, whether it's Florida, whether it's Oregon, whether it's anywhere in the country, we know that this is an issue that's going to come up and people are going to have questions. One of the things that we often talk about is the nativity-based disparities. And you say, well, wait a minute, what exactly is that? Well, nativity-based disparities are apparent across many health outcomes, including substance use disorders and other mental health disorders. However, immigrants are often exposed to trauma before and during the migration process, commonly settle in impoverished neighborhoods, and confront greater language barriers compared with their U.S.-born counterparts. So this is part of the what we call the immigrant paradox. And part of this is really so important to know that the things that some immigrants are faced with are different. They're much different than some of the folks that we serve that might fall into this particular group in terms of Hispanic and Latinos, but that aren't immigrants face. So immigrants face a different set sometimes of barriers than do non-immigrant folks within the group. I just want to put that out there because I think that's important. But that's one of the nuances. That's one of the cultural pieces, one of the acculturation issues that really comes into mind for us as practitioners, whether we're case managers, whether we're probation officers, whether we're social workers, etc. When we're taking down information, when we're getting information, when we're interfacing, doing what we call a get to know you, a conocimiento of somebody, get to know, I think this is important to really take into account of how this person is what they're going through. And in some cases, you know, these barriers oftentimes can turn traumatic or can be a trauma. So there's some implications around this that are very, very important and very, very good. And some of those implications are, as a practitioner, I wanted to make sure how to connect all this acculturation piece to things about how to practice better. And one of the things that there's a knowledge that we really is that really is important. Knowledge of our own racial and cultural heritage. Are we comfortable with who we are and how we're here? You know, a knowledge of the person we're serving, of their cultural values, traditions, or artistic expressions, etc. You know, when we're serving those, we don't need to know everything, but we're in a position of asking questions. So we ask questions. Hey, tell me about you, and that's the piece that I'm talking about. Getting a good picture of their own culture and how they view it and where they're at. The roles of language. Somebody comes in and they need an interpreter, or if there can be some communication, let's see how that goes. Again, there's different interpreter types of options, whether it's face-to-face, having an interpreter on site, or whether using telephonic interpreters. There's different options if interpretation is definitely something someone's going to use. And when there is that, taking into account the communication styles, knowing that the communication styles sometimes of one particular family might be different than another, or one particular group might be different than another. It's very, very crucial. Knowledge of resources, you know, knowledge of how one's perceived, whether you work with the court, whether you work with child welfare, etc., in the schools, how are we perceived? So knowledge of the perception of us. Having been an ex-probation officer, I oftentimes thought I was in a helping role, and I didn't realize later, and I was young, I didn't realize later that I was looked at as the system and possibly a police officer coming to arrest people, because that's what I did. I violated probation. So those kinds of things I started getting to know more and more. And as we talk about knowledge, we also want to talk about the skill building, the skills around this, you know, seeking out educational things like today, education opportunities to increase what we do, our engaging, our connection strategies, utilizing concepts of empowerment on behalf of the client. You know, almost everything we do is focusing on what we call strengths-based kind of approaches rather than deficiency-based models, as some of us were taught in graduate school way back when. So those kinds of things are just so different. And then, you know, attributes where we show genuineness, realness. And I think that's so important to work in something not only that we care about, but to be real within what we work. And I think that is so, so important. You know, respecting people and meeting them where they're at. If somebody says, this is my belief system, instead of saying, no, that doesn't make sense, or just kind of dismissing it, just listening. Doesn't mean we have to believe it. It just means that we listen and see, oh, okay, this is where this person is at, this is what they believe. And then really, somebody comes in and speaks a different language, just, you know, sitting back and valuing that that's what's going on, rather than saying, you're in this country now and you speak English, those kinds of things. So respecting the backgrounds of those we serve is just such an important piece of all of this. And I know I wanted to get to the end here and have some questions. So any questions, I'm open to it as we speak.
Yes, Victor, thank you so much. We have a few questions we want to ask you now. One of the attendees is asking if there's a difference in terms of the acculturation process between ethnic groups, for example, Mexicans versus Puerto Ricans, etc.
Hey, that's a great question. That's a great question, and the answer is at multi levels, because I could say yes, there is. Even within the groups themselves, there is, because and this is something I've been schooled on, working with so many colleagues from Puerto Rico, and I'll use Puerto Rico as an example. Because even the acculturation process, if you're from the island, it's a lot different than if you're on the main in the U.S. So I know that to be a fact, and I see that, and I oftentimes see that same kind of construct with my own group, Mexicans, and other groups. I see that same kind of construct, that the more Americanized you are, the different it is, and sometimes, again, I'm going to adhere to, when we start talking about with some particular groups, the immigration process. If there's a lot of, depending on where you are in the nation, in the U.S., if there's a lot of stereotypes or adherences to some misconceptions around immigrants. For example, I got here with a green card, what they call a resident card, and that's documented, but that's being here legally. But oftentimes people that don't know don't differentiate between illegal and legal immigration. So getting back to the question, is it different between groups? Absolutely, there's differences. I think that if you look at even Puerto Ricans coming into the U.S., you may not have, even though you might have some language issues that come up, you don't have the worry about having to see if you don't have documents, if you avoid border patrol checkpoints, etc. So it's different, and actually it depends on each particular situation.
Mm-hmm. Okay, thank you. There's another one. Another attendee wants to know if you can say a little bit more about the differences between acculturation and assimilation.
All right. Well, the major difference, I think I said something about, acculturation is really retaining something with regard to your culture, but still blending and reciprocating, giving and taking from the host, or the main, if you will, the main group. And assimilation is basically not really forfeiting your own culture, but really blending into the mainstream or host group, and seeing that, well, a lot of times we see it in the form of language, not just customs and traditions. We see it in the form of language. Some people start getting away from their language. Even within my own kids, I see that my kids are speaking less and less Spanish, and that's concerning to me because I want them to retain it. But again, that's contingent upon a lot of things, including their contact with their family, our visits to Mexico, and where we live. And if we live in a place that's 95% Latino, Hispanic, it's a lot different than if I live in a place in the city where I live that it's 20% Latino Hispanic. So there's a lot of factors that contribute to it. So again, assimilation is really a blending and to the whole society and just taking on that information from the larger group and adhering less and less to your own.
Okay, great. We have one final question. This is a two-part question. If you know of any research on the implementation of culturally diverse practices in community mental health settings, and also what specific policy or legislation is in place that you know of to protect institutional discrimination?
With regard to the culturally diverse practices, almost everything that's out there, if you look at it, and when you see practices, I to keep updated, I look at different sites, and we look as a center at different sites. We partner with some sites. We might look on, we'll say, Office of Minority Health site. We might look on the National Center for Cultural Competence sites, and you'll see different programs that are doing different things that are culturally responsive to those we serve. And when I say culturally responsive, it means that they have some programs that are working really well. Some programs still need more and more research to make them what we call EBP, evidence-based practices. But for the most part, almost every program that you'll see on some of these websites are either promising practices or emerging practices, but they're really, really effective. And let me tell you, even though the research is not completely out, most of the research is headed in that direction. And it's not that it's not effective, it's just that research, again, within the last 20 years is a fairly recent thing in cultural competence, has been given more and more importance. And I know it was always important, but it's, in terms of systems mobilizing, it's been given more and more time and priority. Now, in terms of different, the second part of the question, Daris, was, could you repeat it just to make sure I caught it right?
The second part was on legislation regarding discrimination in community mental health settings.
Okay, with regard to legislation, see, I'm a practitioner and a teacher, but more than anything, when we start talking about legislation, I see a lot different lawsuits that have been filed with regard to how to serve or how to provide different things. Here in Arizona, for example, there was legislation to really serve. There was information to serve and be able to provide language access services because there were people that might that were not being served in terms of language. And in the greater picture, when we start talking about the U.S., you know, when we get opened to and vulnerable to things, to people being hurt or not served well at all, language access services not being provided. Well, that's just one piece of it. It's really the legislation. There's different bodies out there that serve to capture and to serve people and to be able to give back. And if for any reason there are any legislative bodies or any legislation, I mean, just the Healthy People 2020 or the different things that are out there from SAMHSA, but almost everything we can access is found in our particular states or setting. For example, again, I said I know what is here in Arizona, but in terms of a national level, whenever I go to a state, for example, we as a center go to a state, we want to know what is happening, and sometimes we find out what's happened here recently, whether it was a lawsuit, etc.
Thank you, Victor. Also, I'd like to remind participants that we have a list of references at the end of your presentation that they can access those in case they want to learn some more about the topics you just discussed. So, thank you again, Victor. Just a reminder for everybody, a recording of today's webinar and PowerPoint slides will be posted and available at www.attcnetwork.org/Hispanic Latino. And also, your feedback is very important to us, so you, at the end of this webinar, you will be directed to a short survey about today's webinar. Remember that if you're interested in obtaining 1CU from NADAC, NDCC, and or ICRC, you may email us again at Hispanic Latino at uccaride.edu. So this concludes today's webinar. If any of the participants have any more questions, you can send them via email. We will most likely post them on our site within a week or 2 weeks, so you can access those. So thank you, everybody.
Thank you.
Yeah. Ah, ok. Se acaba.